Hi there, I'm Daryl McIntyre. Welcome to our latest Raised with Care Stewardship Session. Looking forward to tonight's. If you're not familiar with what we've been doing, these are live interactive sessions that we'll be doing throughout the fall. In fact, this is our second one. We talked about beef last week. We'll be talking about horses tonight and their conversations, both with our guests, but also hopefully with you, because we're live streaming this. So if you have an opportunity that you want to jump in and say something or throw a comment in there, just use the comment section at the bottom of your Facebook Live or on YouTube, and we're watching as they come in. So we're more than happy to have you involved in our conversation. We are basically talking about animal health issues that producers face, ways of identifying them and helping to deal with them. We talk about prevention strategies, how having a relationship with a veterinary team is exceptionally important to ensure that your animal's health is well protected. We talk antimicrobial stewardship, which is very important and has really been talked about a lot more in the last few years, but has always been an important part of taking care of your animals. And then also your bottom line, because the wallet still needs to be protected as well. And we all know that having horses is sometimes not the cheapest thing you can do in the world. So in the coming weeks, we're going to focus on a number of animal groups as well. So we did beef last week, talking about horses. Tonight we'll talk about chickens, we'll talk about pigs, sheep, goat, dogs, and cats. We're even going to be talking about bees. That will be coming up next week, and at the end of the session I'll tell you a little bit more about that. So if you, as you're going through, if you miss an episode, you're always able to catch up on them afterwards. So it's great to be in with you live so we can have that interactivity, but you can also catch up on that conversation afterwards. Just go to raisedwithcare.ca and then you just follow the links. If you really want to, you can follow all of the links and just figure out where they go. But that's your best way of going through it, is raisedwithcare.ca, the website. So our goal with these is to help producers and owners of animals and help by giving you an opportunity to engage with industry experts and ask the questions, have that conversation, talk about best practices, and in some cases be able to tell some of the stories, or at least have the questions that you really want answered about animal health. So leave a comment, ask questions. We really want the feedback, and you will be notified of future sessions as well. There's a little notification bell on YouTube, and if you've been liking and following through the Facebook page, they'll send notifications as well. So and then afterwards they'll all be available. Raisedwithcare.ca / stewardship sessions. All you have to do is go to raisedwithcare.ca and follow the links. You're going to be fine. So we're going to talk horses here. The latest Stats Canada information says that Alberta is a leader in the number of horses in our nation, with some 32% of the population. It's about 313,000 horses in our province right now. Of course, they've been here ever since the West was being won. So they've been a part of our history and continue to be part of our province right now. Some have come up from the south, many came from the east. Obviously, we have a lot of different breeds and a lot of different disciplines that people are using their horses for, and a lot of different unique situations depending on what you're using your horse for. But we'll also even talk donkeys and mules too, if we need to as well, because they land in the same category as well. So I could yap on, but that would get really boring, wouldn't it? Instead, we have a guest who knows exactly what he's talking about. So I'm a horse owner, so I know a little bit, but whenever we need that expert advice, I go to my vet, and this is a really good one. He's Dr. Greg Evans, who's a well-respected veterinarian in southern Alberta, but also a horse enthusiast himself. He was born and raised on a mixed farm near Calgary, and not surprisingly, that's where a love of animals would begin, and then go on to that dream job of being a veterinarian. He went to the University of Alberta in Edmonton and also attended the Western College of Veterinary Medicine in Saskatoon. So he's the owner of Moore Equine Veterinary Center, works on all levels of horses in that practice, and has also volunteered and sat on committees with the AAEP and the ABVMA, and also Equine Canada. So I figured out all your qualifications. You love horses, you're educated, and you're part and parcel of the horse industry. So I guess that makes you perfect.
Oh, well, I don't know perfect, but I'm happy to share what I can share.
Sure. Just to tell me, how many horses do you have? What do you do with them?
Well,
as a vet, you don't have that much time, do you?
No, and that's one of the downfalls of being a horse vet, is you rarely, at the end of a long day of working on other people's horses, some days you don't want to work on your own. But we have 4 horses at our property. Both my wife my 2 daughters and my wife ride mainly Western disciplines, and my family still has a ranch, and we use horses for ranch work. So I tend to ride recreationally to go help move some cows or check some fence, and not as often as my wife and daughters. But I see them every day when I drive up the driveway, and so they're on the property full time.
Yeah, and I think that's really important too that we have you here, because if you're also a horse owner, then it's easier to sort of identify from the other side of the fence a little bit too, right?
Oh, for sure.
Not just as a veterinarian, but also as an owner. And you would hear things, I guess, through your wife and daughters that would be more horse owner point of view as well, right?
Yes and no. I mean, my wife's a vet tech, so she has a sort of a vet background. So, but yes, absolutely. My daughters are very much, excited horse owners and get excited about things that I may find, sort of basic or whatever, but that's great for them. It's how they're gaining their knowledge, and just like clients, I think it's great to take, even 2 or 5 minutes to educate them about a question they have, because that makes them better horse owners in the future. And
that's a big part of what we want to talk about tonight. So we're going to talk about some of the animal health issues that are encountered by horse owners, management of these issues, both how we used to do it back in the day and perhaps how that's changed now. Really important is prevention of future issues. We really want to talk about prevention, and then just talking about being invested with veterinarians to make sure that you have a plan and a program going forward. So just hit the highlights. Everybody has different experiences with their own horses or with what they know, but are there a number of diseases that are likely more common, or that we're most likely to see some kind of an ailment?
Yeah, definitely. I mean, we talk about, there's a lot of horse diseases that are not necessarily infectious disease, so we talk about, the number one sort of scary disease for most horse owners is colic. And so it still remains the number one killer of horses. And so, that's a big word for people. We deal with quite a bit of problems with laminitis and hoof care related issues. Those would be sort of, number two. If we're talking about, infectious disease, definitely, things that the old sort of scary ones like strangles are still very scary.
Every time I hear that word, number one, it sounds harsh, but there has been a lot of myth even just around that one too, because perhaps it's almost like the boogeyman. Because if you've ever seen it, it's not
pretty.
It's not pretty.
I would say that in a horse barn you can swear, but you can't say the S word. So that's one. But probably more contemporarily, like in the last several, maybe 5 years or so, I would say that things like the viral diseases, particularly herpes, which has a neurologic form, which is very scary for horse owners. So that's one that is more, relevant to the traveling horses, the show horses. And then, probably there's been, periodically more news about EIA in parts of Western Canada. And so we periodically, the
EIA is equine
infectious anemia. Yeah. And so every once in a while the CFIA sort of is talking about changing their testing program for that. So that gets into the news feed, and horse owners get excited about that. And so those probably are I think the ones that we get the most sort of general questions about. I mean, obviously horse owners are going to have lots of questions about their specific horse, but if you're talking to someone and they say, hey, what about this, in a general term, those would be the ones.
But that's really what takes us into the management of these things too, because if you have a health protocol, if you have a vaccination program, you have a worming program, you have all of these other kind of things, you're covering off a lot of those taking care of a lot of those dangers, right?
Certainly, and there's no guarantees, but definitely best practices of proper vaccination programs and proper deworming programs, proper, quarantine of new animals on the property. It makes a huge difference in terms of the amount of disease that we see and the amount of those preventable diseases, at least, that we can, if we can prevent them, then obviously we aren't having to treat them or worry about the end result of those diseases. So yeah, I would say that the prevention and the sort of herd health aspects of even horses, we don't think of them as herds often when we're comparing them to, say, some of the, food animal species. But when we say herd health, we're often thinking about that group of horses on that specific property.
And that could be a boarding facility where there's a lot of people, but even if, like us, with 3 or 4 horses still at home.
Or, or these venues that host big equine events, then that's a herd population, but it's a temporary herd because they're only there for 2 or 5 weeks or whatever duration the show is. So we think about things as, sort of the permanent herd versus the temporary moving herd. And so, there's a lot of thought that goes into managing those sites when you are responsible for that.
And that also is a big difference on vaccination. There is no one vaccination program fits all either, because it depends what you're doing. I guess you could say it would be for something like cattle or whatever, but with horses, because you're doing so many different things with them, and they might be exposed to so many different kinds of challenges.
Right. It's never wrong to vaccinate for everything, but there definitely are.
That gets a little pricey.
That's right. It gets expensive, but there are definitely, certain types of horses who are traveling to shows and very mobile and mixing and mingling with other horses, that their risk is definitely higher than, an acreage group of recreational horses that don't really ever encounter any other horses. So,
ours yell at another one from across the road.
That's right, across the road, or
right,
you see one in the distance, but it's not a nose to nose contact or those types of things. But there are some diseases that are what I term environmental, that really all horses are at risk for, and those would be things like tetanus and West Nile and rabies. Really, those are diseases that come either through a carrier in the form of an insect or like I said, with tetanus, a puncture wound. So those vaccines I recommend every year for every horse. But the ones that, are more sort of, not boutique, but they're definitely sort of risk-based assessments, is the ones that are, horses might get from other horses. And those would be, the flu, rhino, strangles, when they're traveling to these different events.
Just as I was just checking out the Facebook feed, our moderator just put a reminder that we're watching the feed. So if you want to leave a comment, you can. So Richard McEwen gave us a thumbs up, and Deanne Latimer is telling Larissa to come watch. So Larissa, I hope you come watch. So if you do have a comment you want to throw in there, it doesn't have to be a question. Just let us know you're out there and you're involved in the conversation. We'd like to have you here. As you go through the vaccinations, and you were talking also about different kind of viruses, when you come back to antimicrobial stewardship, as I always say, it almost goes back to the old human campaign that it was not all bugs need drugs, right? So are you even using antibiotics very much anymore? I guess if you do get an infection, you do get that kind of a thing, then you need them. But what do you would you even use them for?
Right. So certainly, we use antibiotics, routinely in veterinary medicine in horses, and a lot of those they're very case dependent. So, we do use some perioperative antibiotics, prior to castration surgery or a routine surgery. They might get one dose of what's called perioperative antibiotics, so that it's in the bloodstream prior to the operation. But, more often than not, we would be using it for a specific horse that either had a wound that was infected or contaminated, or an illness like a respiratory illness, like a nasal discharge that we had sort of examined. Horse has a fever and a cough. It's likely got at very least a secondary bacterial component to it. Ideally we'd like to culture those things and treat specifically, but often we're treating treating the disease as we're waiting for those culture results based on previous similar cases. But obviously in the past, there was a lot of even when I started, every wound and every puncture and every scratch got penicillin,
because it was more preventative. Well, just in case, throw it in there, right?
Yeah, and everybody slapped Furacin on every wound that happened, and honestly, most of those wounds probably didn't need it, and it was so definitely we've been able to sort of educate clients and sort of even ourselves to learn to trust the medicine, that those types of wounds will be fine. And so I think it's about sort of experience too, to know that you're not going to get burned every time you don't give antibiotics, right?
Have you noticed a change in how your clients, I guess you pretty much have to talk in reference to the people you work with. Is there a change in that sort of an attitude and a recognition that we're all in the same boat and we need to focus on it?
I think so. I don't know if it's as overt as people saying, "Oh, I'm not going to use antibiotics because I'm trying to sort of save antibiotics for the future." But I think they're more likely to ask the question, does this wound need antibiotics? Or instead of right away asking, I need some antibiotics, it's more, does this, or do you think it needs it? And often you can sort of say, well, this is a small wound on the head. It's very clean area. It's going to heal in 3 days. It doesn't really need a week long of antibiotics, right? So I think that's kind of where I've seen it shift is that people are wanting to ask the question rather than make the request.
You know how so many of us have done it in the past is, you know, if say there's a little nasal discharge, or maybe the horse has come up a little bit lame. I would rarely immediately call a vet. I would sort of monitor it, see where they're at, and see what they're, and then determine if it goes away and everything's fine. Well, then it was just a temporary thing. But is that a good idea for us horse owners to do?
You know, I think it depends on your comfort level. Obviously, we would never discourage someone who is really worried about something from contacting us, even by phone, just to have a discussion about, do I need you to come out and look at this animal? So I would always sort of defer to the client. If they feel that they need it, then they should always be comfortable contacting a veterinarian, even for what might turn out to be fairly minor. But if you're an experienced person, you've seen a few, little bumps and bruises, and you've seen, the odd sniffle that gets better, I think, basic medicine is still good. You should be taking that animal's temperature, making sure they're eating well, that they're, sort of able to get around the pasture, those kinds of things would be, basic indicators that things are okay and can be observed for a couple of days. If the problem's getting worse, that's when you've got to jump in. Or if the horse has got, running a fever, then definitely you would want to engage a veterinarian in those cases.
And in that kind of a world, having an animal health protocol, having something set up and having a conversation with yourself or another veterinarian about what the plan is moving forward.
Yep.
That's kind of important, because then when you do call down the road with you might have an issue, you at least have a framework. Maybe you've even been on site and seen what facilities and the other horses are. Right?
And I think that's absolutely the case. The longer you're in practice, the more you have clients that you've had for a long time, and you get a sense of what's their operation like, what do they know, where is their lack of knowledge, or where is their sort of lack of experience in a certain part of horse health, and you get a sense if that client's calling and it's something they're not comfortable with, what their comfort level was. And part of that is just by hopefully having a lot of basic routine visits where you're doing vaccinations, you're doing dentistry, you're doing a mild lameness exam or a minor lameness exam. And over time, you've sort of developed that personal relationship, so that if something were to go really wrong, they have that trust, they have that comfort that this is the person I know, they know me, they know my horses, and I'm willing to have them come and help me with this.
And then also, if you've had an opportunity to go and be at the facility, looking over the facility as well is important too, to see where, and I guess there would be obvious things like a big chunk of metal jutting out of something would be clearly a safety hazard, but you could look at other kind of issues as well, right?
For sure. No, I think, any facility, you get a sense of, well, okay, how many horses live here? Is there a lot of horses traveling in and out of this facility? Do they get new horses in every year, or do they have pretty much the same old herd as always? Do they graze on top of fecal matter when we're talking about parasite, loads and things like that? Are they fed in feeders? Are they fed in stalls? You get a sense of what is the management, what is the ability if you had to restrain an animal to examine it, or if you had to keep a horse in a box stall for a couple of days, do they have the ability to do that? Yeah. All those things sort of you gather with subsequent visits to sort of say, oh yeah, no, they can handle this, or they can't handle this, and this is something we need to have in the clinic or whatever.
And this is something we basically already jumped into the prevention part of it, because that's, the biosecurity issue is really important too, because you were talking about, when other animals are coming in. What is a basic good guideline for, say, a quarantine protocol with new animals coming in?
Right. So, the big worry with horses, from a contagious disease standpoint is really the respiratory. So there's two respiratory viruses, influenza and herpes, or rhino. People call it rhino. That's the old term for it, but it
might be less confusing for some people.
Yeah, that's right. But it's the herpes virus and then strangles. Those would be the big three. And so really all of them have basically an 18 to 21 day incubation period. So to be, really safe, a 3-week isolation, on the property in a separate paddock with no nose-to-nose contact with the other horses would be ideal.
Ideal, but is that realistic for some
You know,
places?
it depends. I think it's probably not for some, but I think, you know, I often say, you know, even if you can get 2 weeks, you're doing really well because, you know, the chances of that 1 week being the make or break situation. It also depends on the type of horse. You know, if you're bringing in a bunch of young horses, 2-year-olds, 3-year-olds for training, say at a racetrack or a training center, they're going to be higher stress. They're like kids in school. They're young. They're
not wearing their mask properly.
That's right. They're not wearing their masks yet. It's kind of one of those things where you've got more shedding happening and more stress susceptible individuals to pick up that bug. So in a training center, for example, you know, vaccination prior to arrival would be really, really important, as well as trying to keep those guys separated for that 3-week period.
I guess it's also, it's nice to know where they've come from and sort of have a history before they ever even get there, whether they've had the vaccinations, whether they've had the shots, that kind of thing.
Totally.
As we were getting ready for this, just on the issue of strangles, you were talking about as a respiratory illness. There was a belief that it was always just in the land.
Right.
That if, you know, strangles got on your property and it was in your land, that you were screwed. Yeah. And that's not the belief anymore. More current
research indicates that most of those strangles cases are actually coming from a carrier, an intermittent shedder. So horses carry strangles, or the carriers carry strangles in their guttural pouches, and occasionally shed, and not always known why they shed. So often when it would appear like there was strangles in the soil or on the property, it was actually in one of the horses on the property.
But they were asymptomatic. They weren't showing anything. Right? So
that particular facility would have intermittent, you know, episodes of strangles in other horses, but there's probably an older horse that might be the chronic carrier. You know, definitely it does survive on organic material and in a water bowl or something for a few days, but it's not like it overwinters in that form. It's more likely that there's an asymptomatic carrier on the property, which is what makes it seem like the property's infected as opposed to the herd.
You see, and that's a cool thing cool. But it's an interesting thing to learn, and that's part of having that relationship and being able to talk. So that if you did come out, or a veterinarian come out, then all of those boogeymen that I'm worried about, you can at least explain what the reality of it is and how to go forward.
Yeah, that's the hope, right? Always is that you can, you know, add a little bit of information, a little bit of accurate science to people's knowledge base, so that they can sort of, you know, make informed decisions going forward about their horses, or horses that, you know, they might know that come into contact with their horse and so forth. So yeah, I think it's again always about communication and developing that relationship, so that you have people who trust you. They ask a question, you can hopefully give them some pretty accurate information, and you know, once in a while that information will be particularly valuable to that particular client and their scenario.
And look, I have horses, you know, they can get costly, right? So, you know, if I talk to you once at the beginning of the year, that could put off a number of other kind of visits where you really get expensive, right?
Well, you know, potentially, absolutely.
If I don't do this, I'm not going to save it. But it actually can save you money down the road, and because it sets you up for better herd health.
For sure. A lot of those herd health kind of those protocols don't require a vet visit. If you call me and say, I have a small boarding stable and I'm having some new horses arrive, what vaccines would you recommend? I don't need to come out and see you for those. Yeah. I can give you advice over the phone and say that client should have their horses vaccinated for these things before they arrive on the property. And so a lot of it is about sort of trying to encourage people to up their biosecurity protocols by just having those discussions about what's best for my facility, what's best for my show property. You know, or I'm taking a horse to a show, do I need to be worried about anything in that part of the world, you know, that's not even domestic to here? Yeah. Right. So those are things too that we have to kind of be aware of, because we have clients doing all kinds of different things with their horses, and the questions are very variable because of that.
Well, and you know, there's also you want to protect the horses. Any animal owner wants to protect their animals, right? But you have people who are traveling with their horses, with their partners. You know, they're not a pet as much as they are more of a partner. Yep. And so there can be almost a paranoia about making sure that they're safe. That's not necessarily a bad thing, as long as it's not over the top. But you want to be vigilant, right? No,
that's right. You know, and most of the time that concern is absolutely, as you say, it comes from a place of wanting the best for their animal, and sometimes it comes out as a kind of a frantic paranoia thing, but really at the end of the day it's that they want their animal to be safe and protected and healthy, and so it's about helping them get there, and helping them sort of or helping them maybe even sort of softening some of their fears if they have some irrational fears about something, right?
Like the
so
boogeyman.
Yeah, exactly.
I think
like
I still
the
have an
Strangles
irrational fear over that one for some reason, whatever. Once again, and we just put up another note here as well, so maybe we're answering every single one of your questions or comments or concerns, or we've dealt with every single area you would ever need to know about equine health. Perfect. We've done a great job. But if not, you think we need something else we need to chat about, go ahead and throw it in the comments section and we'll pick it up before we get going, because as we are getting a little bit later on in this live stream, we won't have that much more time, but I'll make time. Tell you what, if you have questions, comments, and concerns you want to throw out there, we'll make time. Greg doesn't have to be home till later tonight. He's going to be fine. Can you do telemedicine? And if so, how? So when I say telemedicine, that could be, I don't know, FaceTiming a client or a phone call, I guess. Either one of those would work, right?
Definitely we do a level, or even before the whole pandemic, we were doing some telemedicine in terms of, having conversations over the phone with a client, like, this is what my horse is doing. Do you need to come out, or do I need you to come out immediately? There's a lot of people that will send pictures of wounds and little growths on horses so that, to give us some context about what their question is. Yeah,
and you may not be able to diagnose something from a picture, but it does give you a better idea of what the next step would be. Right?
And that's right. And it can give us, some indication of whether that's a urgent thing versus something that we should see tomorrow versus something that needs some monitoring and we can see next week, sort of thing. But in the pandemic stage, we've tried to do a bit more of that, just as a way of distancing ourselves. So it's a little bit, you need to be careful about providing advice to clients and horses you've never met, because that's sort of then you're sort of right? you're sort of, it's more of a I think it's not accurate, and you're more sort of poaching other people's clients, or you're maybe sort of sort of overstepping your bounds. But if
I don't have a relationship with that.
That's right. You need to have a veterinary patient client relationship. But if that horse has a puncture wound or a growth near its eye, and the client wants to send you a picture of it, we can receive that and sort of at least give some advice or guidance based on those things. So that is happening more, and I suspect it will continue that way. Yeah. I mean, ideally, we'd like to, when this is all said and done, we'd like to go back to doing more sort of on-site examinations and visits.
But the technology's there, so it can augment what we would want to do,
exactly.
Right? So that's
and even from a documentation standpoint, taking a picture of something and following it along for a week is okay too, right? Because you can tell if it's getting better or getting worse.
A couple of comments, and let's throw them out there. And this is interesting too, and maybe you can explain why one would be better than the other. The flu vaccines, intranasal or intramuscular, or nasal or intramuscular.
Right. So the intranasal vaccines are what are called mucosal vaccines. So they protect at the site of vaccination, which is often the site of infection naturally. So the theory is that that's like locking the door. The animal doesn't even have to get the virus into their system. The antibodies at the mucosal surface will basically nullify the infection. The intramuscular vaccines are more of a systemic antibody response, where the animal gets the virus into its cells and then the body's cells go and attack those infected cells.
So which is better? More
traditional. Good question. The intranasal is probably a quicker response, quicker protection, but it does present some challenges. Anybody who's had to vaccinate horses intranasally year after year after year, they don't like it. So it does provide a bit of a challenge. And so we tend to vaccinate horses intranasally for strangles, but not for flu, because we just don't want to multiple the intranasals. Because we're creating some horses that are becoming kind of head shy and things, so we'd like to avoid that when we can.
So is it situational then, depending on what you're going to do with the horse and when?
For us, it's not. We use intramuscular flu vaccine, and we feel like it's been protective. But there are There are certain situations, maybe in the face of an outbreak, where you might use the intranasal to get a quicker response. But for the most part, we're using intramuscular.
That's a good question for Lily Ainley. Thanks, Lily, for that. And then Jen Clary wants to talk a little about, and actually, very good point, because I was going to get around to deworming, but I never got there. But now we are. Thank you for getting us there. Herd health, deworming for herd health. Some facilities seem to find the fecal testing difficult in order to try and figure out what to be deworming for.
Good question. And in my career, that parasite control has evolved a lot. When I started, it was sort of 4 times a year, religiously. Then it was, no, we're only going to do fecal testing and never deworm unless they're a high shedder. And now it's sort of what I would consider kind of a blended approach. Yeah. And so I think, probably the ideal situation would be on a facility. It would be really great if at least at the beginning of designing a parasite control program, we could do a fecal on every horse, because then we would understand which ones are the high shedders, which ones are the very low shedders, and which ones are sort of the in-betweens. Yeah. The low shedders typically would not need follow-up fecals. They often only need, once a year deworming. The high shedders are the ones we really want to monitor. And so once we've determined that this animal is kind of a high shedder, that's one we might want to do fecals, every, say, twice a year on that horse, to make sure that we're kind of keeping track of that high shedder.
It's another one of those instances where not one protocol fits every situation. Exactly. Right?
Exactly. And in some cases, we've done sort of blended samples too, where, we sort of say, well, these 4 horses live in this paddock. We don't necessarily know whose fecal pile that was, but we'll, sort of get a sense of what's going on there. There's some, concern that, you might just be unlucky and miss that high shedder when you only sort of grab one sample. And so we're trying to sort of, I would always sort of want everybody to get at least one fecal done on everybody on the property to get as a starting point. And then from then on, we may never need to do a fecal on that particular horse again. But at least if we have that baseline to know who's a high shedder, who's not, and kind of go from there.
This is something, and I've seen this a lot of times, and it's so tempting. So you go and you cut the grass, right? And then you have all those beautiful, fresh, green grass clippings. And the question from Lori was basically talking about some boarding stables who think it's perfectly fine to give those grass clippings to a horse. Just believes that there are serious dangers involved with that. So, anything from colic, especially. Yeah,
the big one probably is a horse overeating, and if it's a horse that's prone to getting gas or spasmodic colic, if they are never exposed to green grass and they're on dry hay, a big mouth or a big belly full of green grass clippings might give them a gut ache and end up with a colic. A lot of those are not going to end up into a life-threatening colic, but they're going to have some cramps and stuff. So I generally would sort of advise against throwing it all in one paddock. If you want to offer a handful to each horse or something, I have no problem with that.
Because I'd always thought that it was not even necessarily the volume, it was the nature of it, that it's
rapidly digested
and it could clump up or something like that as well.
More so that it's rapidly digestible because it's already kind of it's so short, pre-cut. The other concern I have with that is sometimes people will sort of have I guess for lack of a better, a compost pile where they put their clippings over and over again. Well, there you can get some fermentation happening, and so then they're eating essentially haylage, which is probably too hot for horses to handle. Yeah. And in rare cases with horses that have a metabolic disease or have had a history of laminitis, something like that could really trigger another episode. So I think you'll be really careful about doing that, especially with large volumes.
My grass clippings to just give them to the neighbor's cows because they love them and they have 28 stomachs so they can handle it.
That's right.
Yeah. At least another couple of questions here. Sheila's. Oh, hang on. Sorry, Kathy. Sheila, I'll get to yours in just a flash here. Kathy, euthanasia. Once the decision's been made, can you explain the 1, 2, 3? What the owner needs to know and be prepared for? Well, that's a general one, and it's sort of like potentially at the end of life. But yeah, I think it's worth probably just throwing that in there and saying, what do you do? Because we all have to face it eventually. Often.
Yeah, it's unfortunately it's the ultimate sort of discussion or
I have
decision.
one 30-year-old horse and one 31-year-old horse,
and I've got a 33-year-old horse, so they're all
we're
all in that sort of thing. But yeah, I think the biggest thing people need to know, there are options now. There are in terms of what people want to do, and so it's the first part of euthanasia is that it needs to be what we call euthanasia stands for a good death, and so essentially it needs to be done, it needs to be rapid loss of consciousness and the animal not feel the pain of it. So they're really the only options for, well, there's sort of three options for, euthanasia. The standard sort of veterinary option is an overdose of barbiturates, an older anesthetic drug that just we give a large enough overdose that their heart stops and they're gone. You can use a captive bolt gun, similar to sort of food animals, or a free projectile or a bullet. All of them are, if they're done properly, all of them are equally humane. Yeah. It's just it's more what the owners are aware of. With the physical means of euthanasia, there is going to be some bleeding and so forth. So people need to be aware of that. As far as like disposal of the carcass,
because that's also as part of her question too, is the regulations that are around what to do, how to do it, and then disposal as well, and so what the rules are about it.
So disposal, and it probably depends a little bit on municipality. Like burying animals is in some municipalities not allowed, and others it is. So you'd have to check that with your municipality for sure. Mm-hmm. There are some regulations about how far from a property line, how deep to bury. Typically, we don't advise burying animals that had been euthanized with barbiturates because it can enter, it's both, in some municipalities it's illegal, but it also has, negative effects potentially on the, scavengers, raptors, like higher birds like eagles and things. It can be very fatal to them if they get access to a carcass that has it. So
that way, I guess you'd have to be burying deep enough.
They bury them deep enough, or they're composted or incinerated. And so depending on your location, there are companies that provide those disposal services and would know those regulations more specific to where you're at. But essentially, a pretty good rule of thumb is if it's been euthanized with a barbiturate, it needs to be taken to an animal rendering facility. And if they have been euthanized with a physical means, then they're more likely to be able to be buried or composted naturally.
Okay. Natural supplements. Are there any benefits to different natural supplements for a balanced diet? That's a question from Sheila. So nutritional supplements, if a balanced diet is
right.
I read that wrong.
Yeah.
Do you supplement if you have a balanced diet? Right. Do you need to do nutritional supplements as well?
Right. And so most horses are designed to be pretty efficient. So with good quality forage, particularly forage, because that's how their gut is designed, they actually can do really quite well, as long as the forage was grown in an area where there wasn't, deficiencies in certain minerals and vitamins and things like, selenium or iron could be a problem. And so you have to sort of, have your feed analyzed and know what your area might be deficient in. But essentially a normal, sort of recreational level horse, middle age, that's not growing anymore, they can survive very well on just good quality forage. Okay. If we need a bit more energy, you can certainly add some grains or the like in terms of trying to get some energy level up there. As far as supplements go, it depends what you're trying to achieve. There are definitely supplements that are, specific to a certain problem, like, for example, there would be, there's joint supplements, oral joint supplements people are feeding for, to help with soundness and stuff. There's quite a lot of debate about how efficient those things are actually absorbed. And so we usually don't advise for that because they tend to be relatively expensive for little benefit. But in terms of balancing the diet, there are some, just very basic vitamin and mineral supplements that I think it's good to offer as free choice so that the animals aren't deficient in anything. But it's not
like different blocks.
Basically just a multi-min block or there's a bunch of sort of top dress mineral supplements, something like that on top of a little bit of their feed. Just make sure that we're not getting into a deficient state. Now, if you've got horses with specific metabolic disease, elderly horses, young growing horses, really athletic horses, then the diet, then the nutrition becomes a lot more complex because we're trying to feed for those needs. And that's where you really need to consult with your veterinarian a feed company or a nutritionist at a feed company to try and figure out what formulation is really going to be best for your particular needs.
My old guys, we always give them senior feed, like extra extruded feed or senior feed, in order to make sure that they're
getting a little
pounding through there, because they're old, right? And there are a lot more geriatric horses now, because people don't just send them off to the meat plant as often. They pack my butt around for years. They deserve a good retirement. But they take extra care.
Absolutely, and we see. I say this all the time. In my time in practice, the demographic of our horses that has changed the most is the geriatrics. People are keeping them longer, partly because they care for them better all through life. Their hoof care is better, their dentistry is better, their vaccines are better, and those horses are healthier well into their 30s, but they do come with special needs. And so certainly the senior feeds are designed to be, kind of often they have some extra energy in them in the form of fats, so that they don't have the risk of, sort of high carbohydrate diets, but they give them a little bit more calories. And then they also have definitely more vitamins and minerals, which they tend to be deficient in. So I would never discourage someone from using senior feed on an older horse.
Makes me feel good too.
Yep. That's right. And then they come up to,
they're chatty.
Visit with them. Yeah.
They're chatty when that happens. This one's a little on the specific side, but I'm just because we're going to be wrapping up here fairly soon, I'm going to go with it anyway. So Tasha says that her mare has ulcers. Something called bentonite is the only thing that's helped her. Is it dangerous keeping it in her diet long term? Because there are a lot of medications or things that you can't feed for too long.
Right. So bentonite is basically a specific type of diatomaceous earth, clay, and essentially it's a coating and a binding agent. It probably has some effect on pH in the stomach, and that's why it's been beneficial for her mare. The downside of those is that with really long-term usage or high doses, once in a while we run into a situation with essentially constipation, where we can get we can sort of that clay can absorb so much of the water in the ingesta or in the intestinal tract that we can get into impaction colics and that sort of thing. So that would be the reason to sort of ideally not be using it as a permanent treatment, but definitely they can be quite helpful for the sort of in the initial stages, kind of a coating actions, will
it get better?
The ulcers? Normally they will.
Normally,
the tricky part with ulcers is I think that there's two things. Horses are more prone to ulcers than we used to think. For example, when I was in vet school, it was considered a rare thing. Now I think it's about every other horse that I see has the potential to have ulcers, and so I think it's one of those things that has changed our awareness of it. I think some of that is the way we feed them and the way we manage them. So there's some work that needs to be done around how do we best prevent ulcers. Similar to prevention of infectious disease, there's conditions that we maybe need to be preventing and doing things different with the way we feed horses, and we've kind of superimposed our lifestyle on horses, and that doesn't always work for the horses, right? The one thing I will say is that most ulcers are treatable, and we can get them under control through medications and diet change and management change. The tricky part is that the animals that have had an ulcer likely have some of the at least genetic components or behavioral components that may lead to a future ulcer. And it's not that first ulcer didn't heal. It's just that same horse got a second one a year or two later. So sometimes we seem like we're treating the same horse for the same thing.
Okay. I love the questions, by the way. Thank you very much. I'm going to get one more in before we get ready to wrap up here. So, and this is one that I'm very curious about as well, because the pain relief cure-all is always seen to be phenylbutazone, right?
Correct.
So are there other options? Because that can have a detrimental impact if you're doing too much for too long as well, right?
Right.
So any other options besides bute?
So there are some better, or there's some newer generation anti-inflammatories on the market. We talk about them being sort of generation 2 non-steroidal anti-inflammatories. So they're a little safer. They have a little bit less side effects in terms of the gut and the kidney. And the ones that people would be most familiar with is, meloxicam, which is a newer version of a non-steroidal, and the other one is a drug called Thyrocoxib. The trade name for that is actually a small animal drug called Prevocox. And so in certain cases, we use those medications on older horses with probably lower grade chronic pain that we're not going to be able to completely resolve. I do find that they probably aren't as strong as bute for acute severe pain, but they tend to be quite useful for those more chronic. So for a little
longer term, if you do need to have an older horse or something with chronic pain, that's maybe a different, better option.
Now those are particularly the Prevocox, which is the small animal version. It's an off-label use, so it needs to be sort of, it's not been approved on horses, so it's one of those things that has to be prescribed by a veterinarian, and there are some considerations if that animal were to enter the food chain eventually. So there's this each specific case you'd have to discuss with your veterinarian to see if it was appropriate to use that. There are some natural things that people use. Devil's claw, for example, is an old herb that's got some anti-inflammatory properties. Some of the omega-3 fatty acids have some anti-inflammatory, so that's flax oil and the fish oils. They've actually shown in some of the supplements that those things can have basically an anti-inflammatory effect, as opposed to some of the other fatty acids that are more from a corn base that have a pro-inflammatory thing. So we can use some of those. They're not very potent in terms of dealing with a painful horse, but they help with that low-grade chronic pain. So
there are options, and that again brings us back to having that good relationship, that conversation, so you can help drag us through some of the options that are there. Yeah, because I'd always thought too, bute. All you need is bute. There you go.
Very effective drug, but it's old school, and it does have some side effects for sure.
Thank you. This has been awesome. I want to just talk a little bit about what we have coming up next week, and so during that time, I'll let you think about what we might have missed or any final comments you want to pass along before we sign off here. So we've been talking about equine health. We're going to go from really big to really tiny, but a whole bunch of really tiny bee operations. We are talking about if you operate a commercial bee operation at the moment, or you're hoping to get into it, there are some people who are now moving into sort of backyard beekeeping as well, which has a lot of different issues that we want to talk about. That's what we're going to talk about next week. That's going to be next Thursday. So once again, 1 week from today at 7 o'clock on September the 17th. It'll be here on Facebook and YouTube. And our guest is Dr. Erie Spence, who is an expert in apiculture. She's a veterinarian, and we'll have a lot of fascinating insight into this. And so even for horse owners or for cattle producers, this is an area I think that is really fascinating. They've always said that the bees will be like our canary in the coal mine, right? So let's find out what's going on with our bees, how the small little operations might impact the large operations, and what kind of things that they're facing. So we'll talk about that next week on Thursday night at 7 o'clock. Okay. What did you come up with? What gem, what jewel? Because that's always cruel of me to put somebody on a spot, Well, come up with an overarching final statement.
Yeah, exactly. So I think, obviously the sort of the impetus for some of these discussions came from sort of antimicrobial stewardship. But I would say that, as a veterinarian, that is not, that hasn't changed how we think of antibiotics. It's more how the industry accesses their antibiotics has changed. But really at the end of the day, all those sort of considerations that go along with antimicrobials and, disease prevention have been part of our thinking for a long time. So again, I think my number one sort of take home from any sort of discussion is, find a veterinarian you trust, talk to them as much as you can, and learn little tidbits along the way, and you'll become a better horse owner and a better client ultimately, because we can have those dialogues at a higher level, and then your horses will be, in that sort of, they're in the pipeline for our healthcare all the time, right? It's not always a fire engine medicine thing.
Which is not a positive way of talking about it, the fire engine medicine. Dr. Greg Evans, this has been great chatting with you. Thank you very much. I'm going to keep you around here and ask you a bunch of really specific questions about my horses now for the next 20 minutes. No, I'm not. I wouldn't do that. Thank you so much. It's been a pleasure.
Thank you.
Great to have you here. We will have another stewardship session talking about bees next week. See you again here Thursday, 7 o'clock. Thanks for watching.